We've got some mobility ideas for you while you've got your 3-minute breaks in between clusters. So the first one is going to help you with hip pain and also low back pain. And it's working on your hip extension. It's called the couch stretch, which some of you are familiar with, but there's definitely levels to it that are helpful. So the first one is that you're going to take your knee, it's going to go all the way against the wall and the floor. Use an ab mat for your knee. The first thing I'm going to do is keep my chest down. I'm going to push my hip forward, and I'm going to flex my glute. So this is actually pretty deep stretch, just this. So you might just stay here, but you're going to think isometric. So I'm going to flex my glute, push my hip forward, maybe hold for 3 seconds, and then relax it. I'm just going to keep doing that, and you're going to feel a big opening in the front of your hip. So if you want a little more, then you can lift your front leg up into 90 degrees. And you can keep your chest forward while still thinking about pushing that hip forward. We want no flexion in the front of the hip here, all straight. So flex the glute, push the hip forward, and this might be where you stop. So you can do this for a couple minutes, or do it for 1.5 minutes, and then switch to the other side while you're on your break. But again, the flexing the glute is important. We want the glutes and the quads to work against each other and talk to each other, especially when you're doing your kettlebell swings. So the next thing I would do is lift my chest up and see if I can't get my heel to my butt. So in this position, I'm avoiding banana backs. I'm not going to arch forward. I'm going to tuck my pelvic bone, squeeze my glute, squeeze my quad, and same thing. So my symmetrics there. So this is normal range of motion, but we spend so much time in our chairs and sitting, and then we come in here and we do a bunch of stuff, and it gets hard to get into this shape. So this is so important, great thing to do on your break. And then if you wanted to add one more element to that stretch, you could elevate your front foot, which I know is gonna look crazy, but it's really not as crazy as it looks. So I've done the first part. I've got my chest up. Now if I wanted to, I can elevate my front foot and chest up, glute squeeze. Can I still flex my glute? Can I still breathe? If the answer is yes, then it's good. Great.